Starting this week, pandemic-related restrictions on gatherings and business hours have been rolled back. Now, the measure comes slightly more than 2 years since their implementation in early 2020. For more on Korea's path into a new normal, I have Professor Kim Moon-kyu from Yonsei University. Professor Kim, welcome back.
Great to be here again.
I also have Professor Yoo Byung-wook from Soon Chun Hyang University. It's a pleasure to have you back, Professor Yoo. Right, Professor Kim, before we delve into the actual lifting of social distancing measures here in the country, let's touch upon the latest COVID-19 situation here in the country as revealed by our tallies, and also the detection of the XE and XM variants here in the country recently.
Well, the peak daily tally was about 3 weeks ago, but actually 7-day average of the cases were already started to decline 4 weeks ago. It's continuing to decline, so that's a good news. And interestingly, it's following just the same pattern as Denmark, almost the same number if we compare per population, about 8,000 per million was the peak. And one thing different is Denmark started 1 month earlier than Korea, and we're just following that pattern. So I just tried to figure out why is that so similar. We have some similarities if we compare Denmark and Korea. Denmark was relatively spared from previous outbreaks, and since the outbreak of Omicron, Denmark was one of the best countries to deal with COVID-19. They had a brief lockdown, but it was okay. But since the start of Omicron, it was just skyrocketed, and we show the same pattern. And I think geographically, Denmark is a peninsula, and they have relatively easy to block with other influx of confirmed cases. So I think we are overcoming the wave of Omicron right now. But every time we face a new variant, we cannot know 100% about what's going to happen for a while. So as you just mentioned, we have a new emergence of XL, XM, XE or something. But I think that will be similar to Omicron and not a big deal for us right now. But it's going to take about a few more weeks to see the pattern of spreading and the course of the disease and also the consequences. I think this is the time we have to plan for long COVID. We don't know much about it, and we should have the data of our own. So I wish that the authorities make a precise plan to monitor what's going to happen with these long COVID symptom patients.
Right, and speaking about authorities, Professor Yoo, they claim that Korea's current COVID-19 situation is within medical capacity, hence their lifting of social distancing measures. Speaking within your capacity as a doctor, what can you tell us?
Well, since the beginning, health authority and the government say everything is under control and medical capacity can take care of serious cases, but reality is a little far from the mentioned. But anyway, now as doctor, you ask me, yes, we start to breathe. Start to breathe mean now serious cases patient is relieves, and the death case is also a little bit less than before. But my concern is that still we have around 700 to 800 who are staying in intensive care unit. They still need our hands. But fortunately, our dear watchings to our Arirang, you know what? ICU mean doctors and the nurses, medical professional, we can take care of that. More professional, focus one patient, but worse, so more patients, they watching the less medical professional. But now I can tell. So if we don't have any other variants, it's like Omicron and more, it's a stronger one, yes, we should be control of the lift of the social distance measure. But already we are relaxing now. People are already celebrating to free from any restriction. So very difficult to end the social control, but in medical part, if it's necessary, we will ready to accept it.
Right, and maybe to have some kind of control, Professor Kim, the mask mandate has been maintained for the time being, with authorities adding that the decision on outdoor requirements will be made in early May. I think we talked about this before as well, but Professor Kim, what are your thoughts on the lifting of face masks outdoors?
Outdoors, I think it's relatively safe right now. If somebody asks me that, is it sure, 100% sure that there's no possibility of transmission outdoors? It's hard to say it is 0%, but I would say it's very low, about 19 times less than indoors. So you can expect that outdoors is relatively safe in the condition that we have a ventilation, air is moving around. I think in China they are dealing with Omicron in a very harsh way, lock down the whole city. But outdoors activity might be a little bit eased. I mean, it can be eased. I don't think that strong strategy might be necessary. So except a place overcrowded, outdoors mask may be not necessary, may not be necessary, and transmission might be very less. But now almost all the people, Korean people are vaccinated, but still there are some not vaccinated right now. So if you are not vaccinated, I think that person might need an outdoor mask still, and the risk group, high risk group, might have to go and get vaccinations if needed.
Right. And Professor Yoo, what are your thoughts on the indoor requirement of face masks?
Well, some people criticize about it because when you use the cafe and you enjoy the dining in the restaurant, yes, you take a mask. Yes, we did it. But you know what? All the dining staffs and all workers in the cafe, there is a mask, wear a mask is mandatory. For me, I work in the hospital, in the medical facilities. Yes, I never thought of a take a mask, even indoor and outdoor neither. Why? I should be healthy, ready to take care of our patient in my responsible. So outdoor, the wearing mask can be released because what the Professor Kim mentioned about less chance, but cloud is way better too. But it's not the mandatory kind of liberal recommendation. But indoor is different. So even we are take off the mask while we are having food and enjoy the cafe. But in case if you're in the class, in the conference, better to wear a mask because we didn't know who are catching the virus or can be transmitted because even the Omicron the rate of the fatality is very less, but still 3-digit number of the deaths is coming now.
Right. We've also lost 166 lives on this Wednesday as well. Professor Kim, research shows that asymptomatic COVID-19 patients mount a strong immune response compared to their symptomatic counterparts. That being said, what can be done by individuals, generally speaking, to boost their immunity in terms of what they eat and how they spend their daily lives? Well,
before we go into that issue, I would like to remind that there are two kinds of immunity in our body. The first one is an innate immunity. You have it even though you are not exposed to that pathogen. And the second one is the specific immunity. Once you have infection, and then you get that kind of a specific immunity against that specific pathogen. And specific immunity can be also classified as B-cell immunity producing antibodies. And the other one is T-cell immunity. So asymptomatic COVID-19 patients usually have a very stronger innate immunity, like NK cells and other macrophages working against. So that's something good. You might have less chance to get other kind of viral infections also. But those patients with no symptom might have a less level of antibody and less T-cell activities against COVID-19. And research in Nature tells that can decline more rapidly compared to symptomatic patients. So it's very unfortunate that we cannot evaluate that T-cell functions because it's almost impossible at hospitals. It can be done only at laboratory study level. Same principle, I mean, we have to boost our immunity by vaccination. You gain a specific immunity against pathogen, but innate immunity is something, I mean, general. I would say you better stop smoking and you have balanced nutrition and regular exercise and good sleep, hydration. That will help boost our innate immunity. And for specific immunity, we have vaccination. So if you belong to a risk group, if you have underlying condition, if you miss any vaccination, you better have it.
Right. Professor, you on the subject of a strong immune response against COVID-19. Now, despite warnings by the WHO, the African continent remains to have been least affected by COVID-19 because the WHO had claimed that the continent itself might face devastation in light of a massive spread there. How do you explain this reality?
Well, this is kind of scientific curiosity for us because unfortunately our friends from the Africa and who are staying in Africa, they're less vaccinated than other continents. But reality is a little different because they're sacrificing by the COVID-19 virus, not much than others, kind of curiosities. But anyway, so the virus usually came from the Africa, like Ebola and other named is very famous to us, very familiar with us. Why did it happen? Because Africa continent itself is bigger than other continents. And also there are natural environment unknowing virus is there are, but not yet contact with the human beings. Anyway, we are guess is COVID-19 virus from the China maybe, but we're not sure yet because virus came from anywhere, everywhere. But this time we are having the one report definitely in the Bill and Melinda Foundation, they comment again, and CEPI and IBI. Our friends is like global citizen. African people do not have much vaccinated. But anyway, they are least affected. But this one is not matching it. Anyway, they need more vaccination. So these days, Korean government should think about some vaccination we have enough, but the date is coming to expire. So we have to talk about not only Korea, other countries where because we be delayed and they're agitating more for the second booster or something. Let's focus about these, the less of the vaccinations that can be left. We are start to talk about the donating to the African countries. Even their condition looks better. But problem is the statistics in the nation, in some countries in Africa, is not reliable data. So that's why it looks good, but the real life can be different. Actually, this Saturday, coming Saturday, I will go to Rwanda and I can tell you later.
Right, you'll come back from Rwanda to update us on the situation
Absolutely.
in Africa then.
Yeah.
Right, now Professor Yoo mentioned the Bill and Melinda Gates Foundation, Professor Kim, and Bill Gates himself believes that the world will see another pandemic in the near future. Given our experience with COVID-19 then, what preparations do you advise for the medical arena here?
Well, we had a huge buildup of ICU capacities during this Omicron outbreak. That is somehow, I was very welcoming that step because according to the population size, we have very less ICU capacity compared to Germany or United States and most of the European countries. So I wish that we can maintain some degree of those ICU beds as a reservation. And the current COVID-19 strategy actually came out of the MERS outbreak in 2015. And we learned from that, and now we learn from COVID-19 also. So the next strategy is going to be based on this Omicron outbreak also. We have to follow the rules from WHO, but they play the key role, but sometimes it's not that fast enough. And as we are located near to China, we might have to monitor more closely and act more fast and should have a clear science-based strategy. And I think Taiwan was very good at the beginning of this pandemic. They started to move at the middle of December 2019. And that's something we should learn from them also. If a new strain of beta coronavirus breaks out, I think the quarantine strategy might be similar with the ones we had this pandemic. But still, we need more epidemiologists to deal with that. And one weak point of our country is the child age group, pediatric age group. The manpower and all the facilities are not enough. This COVID-19 usually attacked an elderly group, but nobody knows in the future any pathogen mostly attacking young age group or children is going to be very devastating. So we have to be vigilant for any kind of new infection in the future.
Right, we do. And staying with the same scenario, Professor Yoo, what efforts need to be made on the government level to ensure a better response to another pandemic in the near future?
Well, so I believe we live in the peace. Why? Because there are invisible, strong military power. There are no strong military powers, there are no peace, which means we already have experience since 2015 with the MERS coronavirus crisis. After that, many experts recommended we need special facilities and for invest and the training for a certain the medical professional for the infectious disease. Yes, some politicians and government, they promised, but still in castle in the sense. Not yet. So, but now we have a big scar in our hearts, so we never forget. But you know what? Human being always easy to forget. But this time, we have to preparing for like a special military troop, like a UDT and Green Berets, because they are staying as with us like not temporarily, because this time many medical professionals, especially nurses, they sacrifice themselves so much. I really appreciate Korean nurses. Yes, they did it, but their condition is more temporarily contracted. So we need kind of stable contract and the more special doctors who are training for infectologists in peacetime. So we need a special infectologist facility, at least 2 or 4. Either one should be in Seoul, but other for the main city who should take care in the other area as well. So many times politicians and health authority, they promises. So we heard them many times since 2015. But please, so we are waiting for the elections, 1st of June. So we're waiting for your another promises. But I hopefully we have to realize about this, should be prepared for another pandemic. Another pandemic will come, definitely.
Right, so more action right now then.
Yeah.
Professor Kim, regarding Korea's exit strategy from COVID-19, there is talk about the possible lifting of quarantine requirement for COVID-19 patients. What are your thoughts on this?
You know, as I work in an emergency room, already we have many confusions. And this morning I just saw a patient, and the patient started to get fever after the patient attended the kindergarten. And when we were taking the history, I realized that the patient's mother got COVID-19 2 days ago. And I don't know why she sent her child to the kindergarten, knowing that she is already exposed and diagnosed. Well, even though the child is not febrile, you should keep a time of incubation period to prevent going any places or exposing himself to other children. So lifting of quarantine measures is necessary if it's in a clear decline, but some rules we have to keep. So I think it's time to re-empathize how it spreads, what is the incubation time, and why we need those kind of quarantine strategies before. And the kindergarten teacher was with the patient, and she never knew that the kid's mother had a COVID-19, never knew the kid had a fever. So if it happens like that, the speed of decline is going to be, less, and we might face another surge. So I think it's time to re-empathize and re-educate and deal with all these confusions right now.
Right, which is why the government has been calling for informed decisions by members of the public. And staying with that, Professor Yoo, what are some precautions that the public can take to ensure safety as we chart a course out of this pandemic?
Well, last 2 years, I have welcoming because the people have vaccinated against COVID-19. But my concern is people are tend to be more negative about any kind of vaccination. So already in some Southeast Asia, I don't want to mention the name of the countries, already start to the kind of endemic of the measles. Because last 2 years, the younger people, like around 4 to 6 years old, they are so afraid to went to the pediatric clinic to have the MMR, measles, rubella vaccination. It's kind of mandatory, but because of shortage of the MMR vaccination, and parents are worried about the visit to clinic because they don't want to expose their children with the COVID-19. But now, relaxing, they start to be back to the new normal. The problem is well-known, but we didn't vaccinate it like a measles can occur. So, which means the back attacks from the known disease can be also seasonal influenza. I heard that many around the early 60 and later 60 young healthy guys, they say, I don't want to have a seasonal vaccination, especially influenza, for this time because I heard that the vaccine kills me. I'm scared about it. But you know what? So human beings, thank you for the antibiotics and clean water, and WHO mentioned vaccination help to the human races live longer and healthily. So don't forget about it. Probably we need no second booster. I don't want to mention second booster about COVID-19. We need vaccines named 2022 with a seasonal influenza for 2022. But that time, please do your posture and attitudes were not the negative. Probably some of yours who are watching our TVs, probably you need it. Some of your young people, probably you don't need it. But don't criticize it, don't blaming, don't saying low about the vaccine itself because new normal start with the vaccination, definitely.
Right. And regarding safety, Professor Kim, quite a number of people have been using hand sanitizers to keep them safe amid this pandemic. And having said that, what are your thoughts with the use of hand sanitizers or washing your hands? What would you propose?
Well, both are necessary, but if you compare how clean is it making, hand washing is much more better than sanitizer. So in this situation, you can wash your hands, you better wash your hands compared to hand sanitizer. Hand sanitizer is useful when you have no time, no water, or you are walking and you just have to go through sterilization very briefly. You can use it, but in our hospital, if we have those washing facilities, we better wash, and that's more effective.
Right, so soap and water then?
Yeah.
I see. All right. Professor Kim, as always, thank you very much for your insights today.
Thank
and
you.
Professor Yoo, thank you for being with us, and have a safe trip to Rwanda.
Yeah, see you.